Okay, so here's what we're going to talk about today. The arc of tobacco use in the United States, what is in the smoke, how does smoking cause harm, and the very evil practices of the tobacco industry. So this is an interesting growth and decline of cigarette sales in the United States. You notice at the turn of the 20th century, not many people were smoking. Part of the great increase was that Buck Duke, who became the founder of Philip Morris, figured out how to manufacture cigarettes. Up until about 1910, 15, most smokers were rolling their own. It's hard to smoke a pack a day if you have to roll your own cigarettes. But once they were pre-made and you can buy them in a pack, then it became much easier. And you notice as you climb up until about 1964, more and more people began to smoke. The two world wars were wonderful catalysts because we provided smoking free to cigarettes free to soldiers. Women, at first, women were not supposed to smoke. It was an unseemly act, but then that happened. And then beginning in 1964, with the report of the Surgeon General that showed that smoking caused lung cancer, there was a decline in selling of cigarettes. That decline was hindered by the fact that the tobacco industry did a lot of practices, including doing a harassment of people who were studying this, putting out false doctrine, false advertising, and all of that. So this is an interesting graph. This next cartoon shows you why it's so hard to quit smoking. When you smoke, within seconds, nicotine from the combustible smoke enters your brain, goes to nicotine receptor centers in the ventral tegmental and nucleus accumbens area of the center of the brain, where they release dopamine. Dopamine then goes to the prefrontal cortex, where the brain perceives pleasure. The same thing happens with heroin or cocaine or sex. And as you smoke more and more, the brain creates more nicotine receptors. So smoking makes you feel good. And this is why if you stop smoking, you feel worse. And it's why also there is a difficulty in quitting smoking. Now, a lot of people, and maybe even some people on the call, think that it's the nicotine that causes illness. In fact, it's not. Nicotine causes the addiction to smoking, but it doesn't hurt you. It may have very, very minimal cardiac toxicity, but in comparison to the other 7,000 compounds in tobacco smoke, of which about 70 can cause you to have cancer, it's the other stuff in the combustible tobacco smoke that causes you to be sick. And so one of the mainstays of helping people quit smoking is nicotine replacement therapy, which is basically harmless. So smoking, lots of people may think smoking is not a big deal anymore. It is a big deal. There are probably about 500,000 deaths in the United States each year. And one of the interesting things is that as smoking rates have gone down, the deaths that we account from smoking have actually gone up. Part of that is there's a lag phase between the time that you smoke and the time that you die from it. So pretty soon those number of deaths is going to start going down. Secondly, science has gotten better at showing how people die from smoking. In particular, chronic obstructive pulmonary disease. It looks like there are a lot more smokers who got that than we first thought. There are over 5 million deaths annually from smoking, and that may climb, although not in the United States, but in Asia in particular. Of those 500,000 or 540,000 deaths each year, 42,000 is estimated occur in non-smokers who are exposed to someone else's smoke and die mainly of cardiovascular illness. In addition to all those deaths, there are about 16,000 smokers who are running around with chronic illnesses like COPD and cancer who are ill from smoking. And this shows you why smokers die. This is a slide from 2000 where there are only about 435,000 annual deaths. The proportions are the same. You see that compared to other things, smoking is by far the biggest killer. You'll notice a couple of things. One is I've updated the drug-induced deaths from 17,000 a year in 2000 to 60,000 a year in 2016. So that gets a lot of popular press, but still is very small compared to the 435,000 or as many as 500,000 deaths from smoking. This little line in the middle here shows you that about 240,000 of those deaths occur in people who have a behavioral health problem. That is, they either have a serious mental illness or they have a problem with substance use disorders. And this column, the 365, was a premature paper in JAMA to show, oh my gosh, being obese and not exercising is going to soon overtake smoking. Turns out they did the calculations wrong, and the number is more like 112,000, which is still a lot, but is much smaller than smoking. So why do people get sick from smoking? I'm not going to read this very dense slide, but the answer is that smoking causes just a huge number of illnesses, and this is only a proportion of them. So it causes all kinds of cancer. You probably know about lung cancer the most. Causes pulmonary disease, cardiovascular illnesses, reduces fertility in women, causes poor pregnancy outcomes, most particularly low birth rate, causes childhood. If the mother is a smoker, the child is more likely to be obese, and a whole host of other things, including cataracts, osteoporosis, and very importantly, Alzheimer's disease. What does secondhand smoke do? Well, first of all, there is no safe dose of secondhand smoke, but it causes developmental issues, low birth weight, sudden infant death syndrome, childhood depression, respiratory illnesses, cancer, may even cause breast cancer, and then cardiovascular illness. So these are 5 slides that show you how smoking causes illness. The first one with the skull and crossbones shows that people with mental illness or substance use disorders die 5 years or maybe even more, maybe 10 years earlier than those who with those illnesses who don't smoke. Secondly, that the most common source of death among these people is mental illness, is cancer, heart disease, and lung disease. The drug users who smoke cigarettes are 4 times more likely to die prematurely than those who don't smoke. That nicotine has mood-altering effects that can temporarily mask the negative effects of mental illness. So people sometimes smoke to minimize their mental illness symptoms, but it turns out that when they stop smoking, those symptoms get worse, and they attribute nicotine withdrawal to their mental illness or to smoking. And then I can't see that last block, but it shows that if you smoke, you accelerate the decline of illness, of medications you take for mental illness, and then you have to take more of them. And people with mental illness don't like to take those drugs. This slide shows the health benefits of smoking. That within 2 weeks to 3 months, your circulation improves, the lung function increases. Within 1 to 9 months, the little hairs in your lung that clear mucus regain their normal function. You increase you get rid of the mucus, your coughing gets better. By the way, within the first month of quitting, you may cough more because as your lung gets the cilia back, they can clear all that bad stuff that's accumulated. Within a year, your excess risk of coronary heart disease is that to half of a continued smoker. Within 5 years, your risk of a stroke is down to the risk of someone who's never smoked. Lung cancer rate never goes away, your risk, if you're a smoker, but it's down to half of a continuing smoker within 10 years. And within 15 years, your risk of cardiac disease is similar to someone who's never smoked. So it's never too late to quit. These are data from a New England Journal article showing the years of life saved. And even after 65, you'll save about 2 years of life. So compared to your twin who keeps smoking, even at age 65, quitting smoking saves lives. And here's a review that showed that stopping smoking improves mental illness. So smoking cessation lowers the rate of depression or anxiety or stress and increases your mood and quality of life. That the magnitude of the effect of stopping smoking is greater to or equal the magnitude of taking antidepressive drugs for mood or anxiety disorders. And then among smokers with pre-existing alcohol use disorder, smoking cessation leads to a less likelihood of recurrence or continuation of alcohol use problems. And if you're an addict, smoking cessation increases by 25% your likelihood of long-term abstinence. So there are a lot of benefits in behavioral medicine to stopping smoking. And smoking, as I mentioned, causes a tremendous burden of illness in the behavioral health population. 240,000 annual deaths from smoking occur among all patients with chronic mental illness and or substance abuse disorders. Astonishingly, this group, which accounts for about 20% of the United States population, consumes 40% of all cigarettes sold in the United States. And this is a function of the fact that these smokers smoke more and they are more likely to smoke. The other thing they do is they smoke right down to the butt. And so people with SMI, which stands for serious mental illness, die earlier than others, and smoking is a major reason for that. They're also more liable to get symptoms from withdrawal of the nicotine. And then to the extent that they want to re-enter normal society, if they're looking for a job and they've got yellow fingernails or their clothes smell of smoke, they're less likely to get hired. So smoking is a really heavy burden. The tobacco industry is really smart, and they know that many of their customers have mental illness. So these are 3 different advertising campaigns. One is on the far left here, showing that pleasure helps your disposition, aimed at people with mental illness. The second is aimed at people with schizophrenia, showing this jagged slide here, that the merit looks like you're seeing different things. And then on the right, you see that Newport is geared to people of color. The ads are. The top ad from Doral showed that smoking was, so documents have showed that they were giving and marketing tobacco to homeless shelters and psychiatric facilities. And then probably the most striking document that we got was R.J. Reynolds developed something called subculture urban marketing, which stands for Scum. And they directed Scum at the gay and lesbian population, subcultures, and also street people. So the tobacco industry has marketed to people with mental illness and psychiatric disorders and people and substance abuse disorders and people of color. Now, smoking isn't cheap, particularly because taxes are so costly. It's been estimated that people with mental illness or substance use disorders may spend up to 1/3 of their income on tobacco. And some of the panhandlers you may see are panhandling so they can buy cigarettes. And these just show how much a pack-a-day smoker spends on average. Almost $8 a day. It depends on what state you live in. Some of the states on this call have lower state tobacco taxes, others have higher. But it's $55 a week, $220 a month, $26,000 over 10 years. We may be at a tobacco tipping point. National adult smoking was recently at a modern all-time low of 14%. Youth smoking is low. Smokers who continue to smoke are smoking fewer cigarettes. Doctors who used to smoke at the rate of the population are down to 1%. lung cancer deaths in women are declining, and there's more and more stigmatization of smoking. So those of you on the call know that we're in the midst of really good social change, and it's going to be our job to make sure that happens in the housing population. My final slide is sort of a preview of upcoming webinars on e-cigarettes. And this is an estimation. On the far right, you see the bar that shows that a combustible cigarette is having a harm scale of about 100%. By contrast, e-cigarettes are about 5%. And you can see going across small cigars, pipes, and cigars. So this is a quick review of the tobacco industry, the harms from smoking, and I'll now stop and turn it back to Laura and Becky.